Hello, y'all. It's Dr. Sharon with Clinic Reviews. Today we're talking about ectopic pregnancy. You know, I have some people say to me, Dr. Sharon, I got almost all maternity on my NCLEX. And I have other people say, I barely got any maternity on my NCLEX. If you want to be prepared for any eventuality, I suggest watching this video coming up next. Hello, Clinic Review family. It's Dr. Sharon with Clinic Reviews, the very best NCLEX review in the entire universe, in my opinion. Today, we're going to continue with the Blue Book. The Blue Book is right up there. We're covering page 45, Ectopic Pregnancy. And if you're interested in getting a Blue Book, you can get that on Amazon. You can get the Blue Book app. If you go to clinicreviews.com, you can also sign up for our on-demand NCLEX review with the GOAT himself, Mark Klimek at clinicreviews.com. So let's go ahead and get started. We are going to, again, cover the Blue Book content by asking questions. Remember, the Blue Book is all about facts. The NCLEX review that you can get through Clinic Reviews is all about testing strategies and knowledge and understanding how to answer questions. And we focus on prioritization a lot. We focus on a lot of different things. The Blue Book focuses on facts, which is why you don't need to have a review like an in-person or an on-demand review to learn the facts. The book is the book. It teaches you facts. I am writing questions to go along with the facts to help you remember the content. All right. A client diagnosed with an ectopic pregnancy asks the nurse what it means. The best response by the nurse is what? It is a pregnancy that occurs outside the uterus. It is a normal pregnancy that requires close monitoring. It is a pregnancy that has miscarried. It is a condition where the placenta covers the cervix. The correct answer is it is a pregnancy that occurs outside the uterus. So the egg implants, is fertilized, but it implants outside the uterus. Where is the most common site for an ectopic pregnancy? The cervix, the ovaries, the fallopian tubes, or the abdominal cavity? The fallopian tube is the most common site. 90% of the time, an ectopic pregnancy will implant in the fallopian tube. A client presents with unilateral lower abdominal pain and vaginal spotting. Her last menstrual period was 8 weeks ago. Which condition should the nurse suspect? Miscarriage, ectopic pregnancy, urinary tract infection, pelvic inflammatory disease. If it wasn't a miscarriage, there would be a lot more bleeding than just vaginal spotting. And the key word in the question is unilateral lower abdominal pain. Unilateral lower abdominal pain is consistent with an ectopic pregnancy. The reason I'm not picking UTIs because she hasn't had her menstrual period in 8 weeks. They gave me that information for a reason. I need to pay attention to it. Pelvic inflammatory disease, again, they told me she hasn't had a period in the last 8 weeks, so I need to pay attention to it. So I would have either picked A or B since they bothered to tell me that. And because there's not much bleeding and there's unilateral abdominal pain, I'm going with ectopic pregnancy. A nurse is caring for a client with a suspected ectopic pregnancy. Which diagnostic test is most appropriate to confirm the diagnosis? A pelvic ultrasound, a complete blood count, urinalysis, or MRI? I hope everybody crossed off B and C. Neither one of those will confirm any kind of pregnancy, let alone an ectopic pregnancy. So the question is, would we do an MRI or a pelvic ultrasound? MRI is a little over the top. A pelvic ultrasound is adequate to confirm an ectopic pregnancy. Which of the following complications is the most dangerous in a client with an ectopic pregnancy? Hyperemesis gravidarum, gestational diabetes, preeclampsia, or tubal rupture. So this would be considered a complication is something that is bad. Okay, so a complication is something that occurs as a result of whatever the process is. And just like a complication of the flu is pneumonia. Okay, so a complication of the flu is pneumonia. You get the flu, you don't expect to get pneumonia, but it could happen. It's considered a complication. So just like an ectopic pregnancy, you hope it's not going to happen, but you could, because 90% occur in the fallopian tubes, you could have a tubal rupture. It's very dangerous for that to happen. We don't like to see ectopic pregnancies in the fallopian tubes. It's not just inconvenient, it's actually dangerous. A client with a ruptured ectopic pregnancy is at risk for which of the following complications? Hemorrhagic shock, septicemia, anemia, preterm labor. Well, we already said one of the complications is tube rupture. So let's not go with preterm labor or anemia. Let's cross those two out. So if their tube ruptures, do you think they're more likely to experience septicemia or hemorrhagic shock? Actually, peritonitis can occur. Peritonitis can occur, which can lead to septicemia, but septicemia in and of itself is not considered one of the complications of tubal rupture. Actually, hemorrhaging is a problem, which can lead to hemorrhagic shock. So I'm not picking septicemia. If they had peritonitis, I would have said, oh, there's more than one right answer, because it definitely can lead to peritonitis. And you just have to be cautious. Don't say, well, but peritonitis can lead to septicemia. Well, you're right, but actually peritonitis in and of itself can lead to death. You don't even have to become septic, okay, with that. So hemorrhagic shock is the best answer that is here. Which of the following laboratory findings is most indicative of an ectopic pregnancy? Elevated white count, low hemoglobin levels, positive pregnancy tests with low HCG levels, or elevated blood glucose levels. Well, blood glucose levels has nothing to do with any kind of a pregnancy. So, and don't say, well, it could, y'all. A lot of things could be, okay? A lot of things could be. We're looking for, in general, what is indicative of an ectopic pregnancy. Would an elevated white count be indicative? No, unless their tubes rupture, at which point, of course, they're going to have an elevated white count. And if their tubes rupture, they could have a low hemoglobin level, but it doesn't say ruptured. It says in and of itself an ectopic pregnancy. Y'all, an ectopic pregnancy is a pregnancy. It is a pregnancy. It's not carried to term. I don't want to say never. Maybe there's some time in the history of the world where they were able to rescue an ectopic pregnancy. But I would say as close to never as you can get. They're not carried to term. But they still have a positive pregnancy test because it is still a fertilized egg and it has been implanted and the body says, hey, we're pregnant. In the case of an ectopic pregnancy, what is the primary treatment option to prevent complications? So we're not talking about a ruptured fallopian tube. We're talking about an actual ectopic pregnancy. Somebody comes in, they haven't had their period in 8 weeks. They have a positive pregnancy test. Like, I think I'm pregnant, but I'm having abdominal pain and some spotting. And so we do an ultrasound and we see that they have a fallopian pregnancy. We see they have a ectopic pregnancy. What are we going to do about it? And y'all, what we do about it, bed rest and hydration is not the answer. We don't give tocolytics. We don't use antibiotics. We actually terminate the pregnancy. So they actually go in, they do a laparotomy, they go in and clean out any of the fetal tissue that is there, and they make sure that mom is doing okay with that. Okay. So that is ectopic pregnancy. I hope that was helpful to you. It's not super complicated, but it's something you very well could see on the NCLEX. And so I wish you all the best as you get ready to take your test. I get lots of notes from people telling me they passed, and I congratulate every single one of you who has sent me a message saying you passed. Congratulations, and best of luck if you're getting ready to take it. So thanks for being a part of our Clinic Review family.